Certainly. Mr. Chairman, members, thank you so much for having us today to let us talk about refugee services in Texas. I know y'all had a very long day yesterday, and so we're going to try to keep this brief, but be available for any questions.
If you'll bring that microphone just a little bit closer to you.
I'm sorry. It sounds very loud to me. I'm Cecily Young, and I'm the State Refugee Coordinator and the Chief of Staff at the Health and Human Services Commission. The Health and Human Services Commission, Office of Immigration and Refugee Affairs, oversees the day-to-day coordination of refugee services in Texas. It was established by the Texas legislature in 1991 and assists lawfully present program-eligible participants in becoming self-sufficient as soon as possible after their arrival in the United States. These particular programs are 100% federally funded, and they're a federal grant similar to federal grants that we have in other programs that have defined categories for eligibility and defined services. We do not, the state of Texas does not participate in resettlement services. Those are provided through the local resettlement agencies. So,
I'm going to stop you right there.
Okay.
The resettlement agencies. The state of Texas does not license resettlement agencies either, correct?
That's correct.
We license child placement agencies because of the concern regarding the vulnerability of those populations, but not resettlement agencies, which have a very vulnerable population as well.
That's true, sir.
Has there been any discussion ever of licensure of resettlement agencies so that the state of Texas could have some control of resettlement agencies?
Not that I'm aware of.
Okay. Continue.
Okay. As you know, many of you know, there is an entire federal process that happens, an international and federal process that happens before refugees arrive in the United States. And those are, that particular process you'll see on page 3, but it doesn't have anything to do with us particularly. We don't actually conduct these kinds of activities. It's a federally driven program.
Does that process give you any pause based on what happened in Houston with a refugee that went through that process but was either radicalized here in the United States or radical when he went through the process?
I know there are some concerns, and I know that the governor particularly expressed concerns when these issues arise. I know DPS is here and can talk to you about specifics of concerns. I don't know if you want to have them come up and talk, or if you want to have them talk about that later.
The state of Texas does not do, though, any other secondary checks, background checks, evaluations of these individuals
No,
that
sir.
go through the federal process.
That's correct.
Okay, very good, thanks.
Okay. Page 4 really has a pictorial illustration of the services that we provide, but I want to move you on to page 5 and talk about the individuals that are served in these programs. The most important takeaway from this slide is that these are federally designated statuses established by Congress and determined for individuals by the Department of State. You'll see here there are 6 categories, and again, they're federally defined and federally determined for individuals. I want to mention that refugees, special immigrant visa holders from Iraq and Afghanistan, and unaccompanied refugee minor children are people who have been designated, received their federal designated status outside of the United States. So by the time they come here, they already have that designation. Asylees, entrants from Cuba and Haiti, and international victims of trafficking, that designation happens once they're within the United States. But again, our programs don't do anything about that designation. That is something that happens at the federal level. All right, going on to the next page, the services that we provide, as I mentioned, we actually don't provide resettlement services. The purpose of our services is really to make sure that refugees who are in this program, let me back up just one second. When I use the term refugees, I'm really talking about all 6 of those categories. It's too difficult to say refugees, asylees, et cetera. So we don't actually do the resettlement services. These services, the services that we provide are designed to help refugees become as self-sufficient as early as possible.
Do we have any data regarding the self-sufficiency of the refugees after a certain period of time?
We can get that information for you. We do gather employment data from the local resettlement agencies. They're the gatherers of that sort of data.
Do you have any?
We can get that for you.
The fiscal burden of the refugees, can you elaborate on that?
I can. Do you, before we can go ahead and turn to page 15, I believe. On page 15, you can see the state services that refugees access. The largest category and the largest amount is in the Medicaid program. In fiscal year 2015, we had an approximately 25,000 monthly average caseload for a cost of $55 million in general revenue. Most of the people who we served in 2015 were children. So about 15,000 of that 25,000 average caseload is children. And we get the regular federal match rate for these recipients. And it's interesting, of some interest to you maybe, that the refugee cash assistance and refugee medical assistance is for a period of up to 8 months from the time of arrival, but they first must be determined ineligible for TANF and Medicaid. So we normally think of Medicaid as the payer of last resort, but in the case of these particular, that's correct.
And this dollar amount here, $56 million of general revenue for fiscal year 2015, which is $189 million all funds. The majority is Medicaid. This is not. These are actually still individuals classified as refugees. These are not refugees that become permanent residents and are still on Medicaid. There's a whole subsection of those, right?
I'm sorry, I couldn't hear part of that.
There is after you become a refugee, after a certain amount of time, you become a legal permanent resident.
Yes.
And
yes, sir.
As a legal permanent resident, if you still qualify for Medicaid, you can continue on the Medicaid program.
Let me get back to you with the details. I believe this does include legal residents as well. They have a refugee code, but I will verify that for you.
Okay.
Sorry.
Go ahead.
Okay.
Mr. Chairman.
Sorry. Yes.
Mr. Chairman.
Senator Taylor.
Thank you, Chairman. So for legal resident aliens, right? So
yes.
Someone who, my sister's husband is from another country,
okay.
Right? So he, when my sister gets him his green card,
okay.
she actually certifies, and this has been the case for federal law since the 1880s, that she will pay for any public services that he consumes. So if he
yes.
went on Medicaid, my sister would be liable to pay for her husband's Medicaid consumption, or for food stamps, or for any or TANF, right? So with refugees mm-hmm. under this program, unlike legal resident aliens, the state is actually obligated to assist and provide services for the legal for refugees.
For refugees, that's correct.
Okay, and the federal government is not coming back and compensating us for it. They're just like, hey, you guys are eating that. So the more refugees that come to a particular state, whatever mm-hmm. state that may be,
yes, sir.
The higher the burden is on the taxpayers of that state to support those refugees.
That would be correct.
Okay.
Senator, in addition, the refugee status is one thing regarding Medicaid being the first provider at a regular LFMAP mm-hmm. rate. The other issue is after a certain amount of time, I think 5 years, they can become citizens
yes.
or legal permanent green card residents. And those individuals are not, my understanding is they're not included in these dollars. So you can have a continuation of the financial obligation of the state in a whole different population, not actually picked up on this slide 15.
That's correct, sir.
Senator Colhurst.
If you would go to the Medicaid line there, when we talk about that, and you said it's mostly children, mm-hmm. so the only other way that you qualify for Medicaid is, you're children of lesser means, you're a pregnant woman,
yes,
or you're aged, blind, and disabled, right?
Yes, so I can give you a breakdown of the risk categories if that would be helpful. I know we've supplied them to y'all staffs, but we have about 15,000 non-disability related children in this number, and again, these are average monthly caseloads. About 4,500 TANF adults, which would be associated with kids. About 3,000 disability-related and smaller numbers of pregnant women, aged and disabled. So it does run across the risk groups.
So in the states that have done Medicaid expansion, then all of them fall in there if they're below the...
That would be correct, because just as anyone else, these recipients are screened with the same screening criteria. So you would be correct.
And then talk to me about emergency Medicaid. If a refugee, can you hear me? If a refugee shows up at a hospital and they are not in one of the categories that we as Texas traditionally cover as Medicaid, then the hospital gets emergency Medicaid, correct?
That's correct. And if you'll note on this chart, under other programs, those 118, some of them are some of those emergency services.
Okay. And then I wanted to follow up on the senator's comment, after 5 years, a refugee becomes a citizen or can become
a
or a
citizen.
permanent resident.
And that number is not on, again, on page 15. Once you become a citizen, unless we track it somehow that I'm not aware of.
We don't, that's
we don't.
correct.
They
sir.
can, if they meet eligibility criteria for Medicaid, they can continue on the program, of course, as citizens of the United States.
Mr. Chairman.
I think Senator Perry.
So back to page 5, in your lead-in was, this is all federal grant dollars. So are we to assume that the grant dollars would cover your salary as a state employee, that your department would be covered, the maintenance of effort, all of your staff, all of those that are integrated, that all is under federal grant?
My salary is actually not covered by it, but the program staff are. There are 20 FTEs associated with these federal funds, and that amount, just so you'll know, is on page 14.
Okay. And it's not specific, but I just want people to be reminded that federal programs with grants are not free.
That's
And
correct,
that
sir.
there is an ongoing maintenance of effort, but a lot of times the small amount of administrative costs they give you doesn't even begin to approach the cost to the state taxpayer. Secondly, page 13, and it's an important point, I think it's relevant. We get a lot of, this is just kids, and if I do my percentages right, 26% is 15 or under. Now, I would like to see the green category 16 to 25 broken out a little differently.
Okay.
If the age is 18, where we consider people an adult in this country, I'd like to know how much more, because if you do the math, then you're truly 74% over on the spectrum of non-kids, but it includes part of that 16 to 25 demographic.
Okay,
So,
we can
and
get
that's,
that information
and I don't want to be political, but that's one of those arguments that we get every day, that it's just the kids coming over, and it's clearly, even by this chart, not just kids.
That's correct.
And that doesn't mean that people deserving over adulthood are not deserving of refugee status if they're truly meeting that criteria. It's just, I think we get into the numbers, and when we see a chart that says 16 to 25, that's 19% of the group. Is that skewed towards the lower end or the bigger end?
Okay. We'll get that information for you, Senator.
One other question regarding page 15 and costs of the refugee programs. I don't see anything regarding, for instance, EMS or mental health, which would be through the Department of State Health Services at the current time, or schools or things like that. I think the Amarillo mayor is going to speak to some of those costs, but that is not on this page.
That's correct. These are only the services that the Health and Human Services Commission provides, and that we have a coding for refugees. So you're correct, sir.
Our policing from a sheriff's standpoint, our police service.
One other follow-up on that. Medicaid expansion.
Senator Perry, you're recognized.
Senator Colcourse raised the issue of Medicaid expansion. So if I understood that correctly, under the woodwork effect, those eligible but not enrolled would have not have been included in Medicaid expansion. But would these be under the expansion reimbursement side that was pitched under Medicaid expansion, or would be under the FMAP program if they come into the Medicaid?
Right, whatever would apply to the general population would apply for people who are eligible and under their refugee status. You're correct.
So all of the refugee status would be paid under the FMAP formula for Medicaid?
If they fell into the category where they would be under the FMAP as opposed to the higher match rate for whatever that period of time would be. If you'll go back very
hang on one
briefly,
second. We have a number of other questions for you. The LFMAP is 58% or so. We don't have an enhanced LFMAP for the refugee designation.
That's correct. You're correct, sir.
Senator Uresti, you're recognized.
Thank you, Mr. Chairman, members. So going to page 15, so I was doing the math. It appears that for GR, for a caseload of 25,000 people, it's roughly $2,200 coming out of GR per person, on average.
Okay.
And how does that compare to a Texas citizen? Is it about the same, or the cost greater because they're refugees?
So, Senator, that's a great question. Because they fall into certain risk categories, the cost would be the same for the refugee within that risk category. Does that make sense?
Yes. Okay. And then I did the math considering all funds. Does that change? Does your answer change at all when we consider all funds?
No, sir. It would be the same.
All right. Thank you.
Okay.
Senator.
Mr. Chairman, thank you. Ms. Young, I want to go in a different direction, okay, so that we can get a complete picture here of what we're talking about. Okay. Number one, you already indicated, and just to restate it, these are legal refugees.
Yes, sir.
We're not talking about undocumented individuals.
That's correct.
That are accessing these services.
That's correct.
That because they're legal, they're entitled to those services.
That's correct, sir.
Okay. Secondly, we're hearing a lot about these costs to the taxpayers. And I mean, there's no question there's a cost to the taxpayers. But I wonder, I understand we will be having some testimony that 82% of these refugees find employment. Are you aware of that?
It probably depends on how long they've been here. Again, the whole purpose of the program that we administer is really to get people into self-sufficiency. So their job training, language skills, translation, citizenship services, et cetera.
Do you have a sense of whether the majority of these refugees that we're talking about actually find employment, are employed?
I think that they do.
All
Patrick,
right.
let me let the program administrator, Patrick Randall.
Hello. Thank you. Our understanding anecdotally is that refugees over the lifespan or the time span of their initial resettlement and then thereafter do achieve, and employable refugees do achieve employment. Within HHSC, we administer a portion of the federally funded refugee employment services, and the snapshot for those services is a relatively small, narrow snapshot, and we could provide information specific to our contracted employment service providers for that snapshot. I know that there's a resettlement agency that will be testifying today. They could speak to their particular site as well.
Yeah, I think we'll hear testimony that almost upwards of 82% of them find employment, which is higher actually than the national average of about 65%. And so naturally then the question is, have you calculated the state tax revenue generated by refugees that are employed?
No, sir. We have not.
Does anybody calculate that?
The comptroller might. I don't know.
Okay.
We would have to find out.
So if you don't do that, or somebody in the state, how do we know if these refugees that are being resettled here under their program, how do we know that they're not actually contributing a net gain to the economy?
Without knowing how to calculate that. Again, we primarily provide just the services to help these refugees become...
You all don't have any plans to calculate it?
I'm sorry, I couldn't hear you.
You all don't have any plans to calculate whether or not there's a net gain to the state? Because what we're focused on here is look at how much it's costing the taxpayers for these services that they're actually eligible for and entitled to as legal persons here under our immigration system. So it seems to me that we ought to look overall at, how much are the costs, but how much are the gains, right? I recall, Mr. Chairman, that Carol Keaton Rylander several years ago did a study and concluded that there was actually a net gain, and she was talking about actually undocumented immigrants in her report. So anyway, that's why I'm asking those questions. And it seems to me that's the only way we can get a sense of what the impact to the taxpayer is if we look at those things. Can you tell us how much money the agency spends each year on providing health literacy for refugees to educate them on how to navigate the healthcare system?
I can, if you'll turn to page 14, you can see that the program is about, for fiscal year 2016, we anticipate it's going to be about $68.3 million spread between the Health and Human Services Commission cash assistance, medical assistance, social services, and some of the specialty grants, discretionary grants, the URMs, the unaccompanied refugee minors, and the health screenings.
Well, that's global, but I'm asking about health literacy, so that the refugees can navigate through the healthcare system here in the state.
We can try to find out for you. I don't have that information.
You don't have that figure?
Not right now.
I assume you do some of that, health literacy?
Well, that's not one of our primary federally funded services that we're responsible for currently.
It is not, you said?
It is not one of our primary federally funded services that we're responsible for. I think we've talked about the main services that were funded through the Federal Office of Refugee Resettlement, and that focuses on employment and self-sufficiency, case management, and to an extent, service brokering with our local communities, but health literacy hasn't been one of the target areas under our main formula funding.
Well, and I understand what you're saying, that it's federally funded. Should we not ourselves as a state be funding health literacy programs for these folks so that they can understand the process and maybe not, misuse it or, go to the emergency room or these kinds of things that we're trying to avoid?
Dr. Hellerstadt, do you want to talk a little bit about, can we talk about the health screening program with Dr. Hellerstadt, and he might be able to talk a little bit about the kinds of things that they do as well.
If that's...
Let's not go to there just yet.
Okay, I'm sorry.
Well, Mr. Chairman, I mean, do we do anything to help deter the usage of emergency rooms by refugees? I mean, we do have a policy of trying to avoid that for cost savings purposes. I mean, do we do anything with regard to the refugee resettlement program to deter the usage of emergency rooms?
I'm not aware of anything that we do regarding that, sir.
All right.
I would bet that emergency rooms are the first line of care for refugees, at least initially.
Excuse me, Mr. Chairman?
I would bet that the emergency rooms are the first line of care for refugees for a number of reasons, one of which is whenever you are a Medicaid provider, one of your obligations contractually is translation services. That is not paid for by the Medicaid program. And I, as a provider, have had individuals that spoke foreign languages. We would have to use a translational service, which costs many dollars, $30, $50, $100. You'd be net negative not only on your reimbursement from Medicaid, but also significantly net negative because of the translational services. You're significantly paying to see that patient. Therefore, it drives individuals to the emergency room.
Well, and I appreciate that. I think that is the case. I'm just curious to see if we're
going to see that also with law enforcement and translational services, and the cost being borne by the city of Amarillo.
Yeah. Okay, we'll hear about that. Do you provide as part of the program any any orientation on cultural and
Yes, sir.
background norms for this population?
Yes, we do. That's part of the social services piece of the funding. And so there's cultural orientation, there's case management, and actually, Patrick reminded me that case management may provide some assistance to refugees in navigating the healthcare system. We just don't know the particulars of how that would happen. But
Do you work with the community, the agency's faith and community-based initiative on these issues and equipping the nonprofit groups to work with these populations?
so the local resettlement agencies do work with our office on particular issues regarding services. So if there is an issue that comes up in a certain area, they contact the office to try to help them work through those issues.
Including the community-based
Faith-based
Base group?
organization? Yes, sir.
All right, thank you. Thank you, Mr. Chairman. Thank you.
Mr.
Thank
Chairman.
you,
Yeah,
Senator.
Senator Perry, please.
Just real quick, and this may not be your area of expertise, and we may have people coming up later, but I understand that they're qualified from the federal government before they ever hit
Yes, sir.
Texas border.
Yes.
But do you know if there's a visual kind of one more checkpoint when they enter into the Texas system, so to speak? And by that I mean, my passport gets me into Europe. Somebody looks at it and checks it. Is there a process that still occurs even when they're here? And if that does not check out, or if they don't have the proper paperwork, or if that doesn't make sense, or some red flag comes up, do we have any control at the very final stage of admission?
That's right.
So if someone visually checks it and says, "I'm Joe Smith," you look at that individual and their paperwork doesn't align, there's nothing that Texas is charged to do at that point?
I'm not aware of anything that we do. I would assume, although I can't speak authoritatively, that the local resettlement agencies would do some sort of verification that the information, that the people that they're serving and resettling are the people that.
We're not sure. of that.
But Ms. Young, to
but it is not
clarify
something
that,
we do.
the state has no jurisdiction
That's
over the
correct.
resettlement agencies.
That's
We
absolutely
do not
No
license
jurisdiction.
those resettlement agencies.
That's correct.
And Mr. Randall, or either Mr. Randall or Mr. Young, can you speak just more broadly to that topic, Senator Perry, regarding the provisions of resettlement requiring coordination with the states? And the governor has voiced his concern regarding that coordination, that word coordination. How
Yes.
are we being coordinated with?
That's a great question, and actually, the federal law does require consultation and coordination with state and local governments and with community stakeholders, and it's incumbent on the federal government and on the local resettlement agencies to initiate that consultation.
But we don't have any jurisdiction over those resettlement
No, that's
agencies.
correct, and so. In fact, while we can comment and give input, nothing that we say is binding on either the federal government or the local resettlement agencies.
Did we not once, regarding unaccompanied minors and the issues associated with their proper oversight and care, license, and Judge Speech, you can speak to this, as family residential centers to make sure that the care being provided, the provisions of the way those individuals were being handled, did we not do an emergency rule to license and regulate the 2 detention centers as family residential centers? And is this not something that can be discussed regarding this issue as well, regarding individuals, vulnerable populations coming into Texas that need help, but at the same time offer some theoretical potential threat to our citizens? Can you speak to that?
Sure, Senator. I'm John Spacia, Commissioner of the Department of Family and Protective Services. Recently, we issued an emergency rule to license the emergency detention centers. That was in the licensing division of the Department of Family and Protective Services. Both the Carnes facility and the Dilley facility have submitted applications for licensing. We are in the process of doing the licensing review. There's required public hearings. One has happened, one's about to happen. And so possibly within the next 30 days they could actually achieve their license. But we issued an emergency rule based on if these children are in a facility that cares for children, that they are very similar to our GROs, and therefore they should be licensed, and we are working on that issue right now. We do abuse and neglect investigations in any GRO or these two facilities if there is a call made to the hotline. So we are now looking at health and safety issues, playground safety issues, how medication is handled, qualifications of staff in those two facilities.
And that is a separate population. I guess a more appropriate, potentially more appropriate population would be placement agencies, CPAs that we discussed yesterday. Those agencies are already licensed.
Yes, they are.
Right.
And
they are providing placement of children, in this case, to foster homes or adoption, as well as wraparound services and care of those children, not unlike what resettlement agencies undertake regarding placement into the community, assistance of basic needs, employment assistance, in this case in the adult population that are eligible to work. But there's, as we saw, some children in these resettlement agencies and the families that they're placed with.
Right.
But the state doesn't take any oversight responsibility of this vulnerable population at all?
Well, my agency does not license resettlement facilities, but we do relicense every GRO in the state that provides services to ORR children that are placed by the federal government, and we are in the process of licensing both the Carnes and the Dillity Family Detention Center.
Let's just be clear, the state of Texas doesn't license through any of its agencies, the resettlement agencies.
That is what
Dr. Hellerstadt, would you like to
morning.
speak to that? Or
Sorry, I'm having very...
to be clear, the state of Texas does not, through any agency, license resettlement agencies.
That's correct. Yes, sir.
Members, any other questions? Senator Colkers?
I want to follow up on the graph on page 13 that shows 56% arrivals to Texas by gender, 56% are male and 44% female. Is that only for fiscal year 2015?
That is, yes, ma'am.
And that, again, to clarify, I don't always hear well here, is for those that have sought these types of services.
These actually reflect arrivals.
Okay.
Yes.
So,
yes, ma'am.
you know, often, and this was a surprising chart to me as well as page 12, often it's described as women and children arriving in our state, and this chart shows 56% being male, and then on the chart on page 12, 38%, the largest segment arriving are ages 26 to 40. And I would just say, as a matter of Homeland Security, I hope that our federal government, and I know that Congressman McCall is chairman of Homeland Security in the United States Congress, are looking at these issues to make sure that we are protecting our citizens across this great state, and that we don't have a situation similar to what we have seen with some of our European countries.
Yes, the SAFE Act of, I think Congressman Cole is championing. You know, I think Europe has, you hear the stories on TV, I think there's 4.2 million Syrian refugees worldwide now, and the stresses that are placed upon those countries when a number of the absolute number gets to the point that it overburdens the system. Certainly we're not that way here in Texas or across, but we do have an absolute requirement, I think, as legislators to protect our citizens and make sure that we evaluate the safety aspects of this program from a state perspective and ways that we might be able to improve that safety assurity to our citizens.
I have one
Senator
quick follow-up, which happens to be on the issue with our border to the south. And it is my understanding that if someone arrives from Mexico, they're not a refugee. And in the immigration process, many times, if they're detained, then sent back to the country. There are other countries that are designated as refugees, and I know that's done by the federal government. The summer that we had, which would have been the summer of 2014, I think, when we had the unaccompanied children issue, of which many were from South American countries.
Yes, ma'am. From South America.
Of those, were they all considered refugees?
They were not.
So, not to belabor this, but then
Okay.
what is the process different for those children, which are not reflected in these demographics? What access to the services are they able to do? Because that's a whole different category, and I know that Texas, we really had an issue at that point, different than what we're talking about Syrian refugees or Iraq refugees, Middle East refugees. Anybody want to?
Yes, I can account. The refugees, when you obtain refugee status as a child, all those children are from another country, all over the world, and they obtain refugee status before they come to the United States. And when they come to the United States, they are refugee minors, and we have a program that we work with those refugee minors. Those unaccompanied refugee minors who have the status has already been declared when they get here are entitled to the full range of services which are available to all foster care children in Texas, except for state university tuition waivers. The total number of those children right now is about 123, and it may rise in 2017 by about another 25. Those are the ones that are legal refugees and come, and they're placed in foster care with Catholic Charities, and Catholic Charities has conservatorship of those children, Catholic Charities of Fort Worth and Catholic Charities of Houston.
That's an interesting statistic of how small those numbers are, and yet I look at these demographics and then I turn to the pages of how much money we're spending, and so obviously we have a lot of refugees that are, I'll work with you on those numbers.
We can go, these are not placed with families, but we can sit down and go over all the numbers with you. These do not have parents. There are no parents to place them with. There are no relatives to place them with, so they're placed in foster care.
And then I know that Senator Rodriguez wants to follow up with a question, and then I want to just get into quickly the screening and the vaccination issue after that.
I wanted to follow up with a question because I wanted to clarify your apparent confusion in looking at these charts where you made the statement that these charts show 56% male, but it was your understanding that there were, a lot of children and women. And the answer is, I think you just heard it from the judge, is that these charts, to be clear, are reflecting legal refugees being allowed, their arrivals. These are the legal refugees coming into the country, and so that demographic is for the legal refugees. The unaccompanied minor issue that you raised is, as was pointed out, a different issue. Those are not legal refugees at this point. Some of them are, in fact, trying to achieve refugee status, but legally and technically under the law, they came in without proper authorization, so therefore they're in deportation proceedings unless they can persuade a judge that they are entitled to refugee status. So those are two different populations.
Yeah, they are, and I blurred the line there just slightly, Senator, and thank you for clearing that up, because even with refugees, often I think that the image that many of us, and I'm just a Texas citizen too, we kind of had that idea of fleeing a country in trouble, and many times it is women and children. I was a little surprised about the legal status, but yes, we know the unaccompanied minor, and I wanted to clarify that they're not in these, and they weren't refugees, and that was a whole different phenomenon that occurred because of unrest in some of the
Central America.
Central America politics, plus I think some misunderstanding of what was going on here in the United States with policies that were not happening. So I do want to say again, the demographic of the 26 to 40 being the largest of the refugees, legal refugees, and the 56% male, surprising to me at least.
Thank you, Senator. I have a question for Mr. Randall or Ms. Young, and I just want to make 100% sure that my understanding is correct regarding the second look or background check or visual evaluation of these refugees. The state is not performing in any way.
That's correct, sir.
Right. The state, I know there are federal programs that help with some of the uncompensated costs, such as translation services for law enforcement, for instance. The state of Texas doesn't involve themselves with providing state grants to the city of Amarillo to pay for uncompensated costs, do they?
Not that I'm aware.
Right. The contracts that we have with placement agencies, we do have a contractual relationship, do we not, through your office?
That's correct, sir.
Does it have any provisions that have been discussed or thought about regarding the writing in some state oversight of the business of placement agencies regarding the individuals and the safety issues that are rightly a concern for many citizens in this state? Have we ever written anything into those contracts allowing us to have better oversight?
As I understand it, the contract, and you may need to help me, Patrick, with some of the provisions of the contract, but the contract primarily is about how they provide the services as opposed to things like the safety piece. Have
you evaluated other states' contracts regarding this type of issue and how other states go about the business of making sure the individuals within their borders are not in a position to do harm to the citizenry as a whole? We have not.
We haven't, but we can reach out to other states.
And we, again, do not license these agencies at all. And has that ever been contemplated or discussed?
Not to my knowledge.
And how many agencies do we have in the state of Texas that are placement agencies?
There are 19.
And do we know how each one of these 19 operate regarding after they pass the state Department of State background and the now expedited process for Syrian refugees? Do we have any sort of assurances from the agencies that they are doing their own quasi-review, evaluation, inspection, reporting to you if they have any concerns?
Our relationship with these agencies is, again, as Ms. Cecily Young was saying, regarding the services, the contracted services that they provide, as opposed to the resettlement side of it, which is with their national organizations and Department of State.
Right. All right, thanks. I was just confirming what I thought. Thank you. Any, Senator Perry or Taylor?
Thank you, Mr. Chairman. So how many refugee children are in Texas today?
Oh, gosh.
I know you've done a great job with lots of numbers and stats. I don't want to.
Can I get that to you? I would have to do calculation, and I'm afraid to do calculation in public in my head.
Okay. Well, I for one was surprised at the high utilization of Medicaid services by this population, and I really think it goes back to what Senator Rodriguez was talking about earlier about the question of, hey, are they using this? Do they know about it? But if you look at the numbers, geez, there are a lot of refugees, and that's only for people who are 100% of the federal poverty level or below, right? The children must be
It would be exactly the same eligibility as Medicaid.
So that's 100% of federal poverty level or below. So there's a high utilization level of this service. Clearly, there's an understanding. I think if you were to see, a very small percentage, you would then say, gee, they don't really understand it or get it. But clearly, there's a high utilization, so clearly they do understand it, and they are accessing it, at least.
Or for some period of time.
Yeah, yes. And with relatively, it seems like high numbers, but you would need to know how many there are, and
And
then
how-
how many
and
are
how many,
100%
yes.
FPL, and then sort of figure out that stat to get a comparative, but still.
We can try to get demographic information for you on the
Right.
kids
But
that are in
I think
program.
Senator Rodriguez is really asking that question.
Yes.
I mean, hey, do they know about it? Are they able to use it? Clearly, there's a lot that know about it and
Yes,
are
sir.
using it. Thank you.
Thank you,
Mr. Chairman.
Senator Taylor. Senator Rodriguez, do you have another follow-up question, sir?
A question about page 17. I don't know that you've gotten to it yet.
I'm sorry, tell me.
A question about
17?
page 17.
Okay, certainly.
You state that communities have cited concerns about the high number of refugees resettled in the area as compared to the overall population, high number of languages spoken in schools, and the treatment of varied medical conditions. So I guess what I'm trying to figure out is how many communities have cited these concerns to you?
I think you're going to have a panel following us that talks about that. Amarillo is one of the places. I know that there are some concerns in some of the local resettlement agencies that has to do with the number of Cuban entrants because they arrive afterwards and are not contemplated in the original planning that these local resettlement agencies do. And we've seen the number of Cubans rise fairly substantially over the last couple of years. I think in last fiscal year, we had almost 5,000 Cubans compared to 2011, where we had not quite 1,000. And in this fiscal year, we're seeing already about 4,500 in the first 2 quarters of the fiscal year. And so some of the local resettlement agencies have talked about how they have had to use other funds that they get from their communities to help offset some of those costs. So,
Okay, and now I was curious because you said communities have cited concerns, and you mentioned Amarillo, and I know they're going to be testifying, but I was wondering what other communities besides Amarillo, when you say Cubans, now you're talking about a category that's even different than the regular refugee program because they're automatically allowed into the country. So you don't have more specifics on what other communities have expressed concerns? And the concerns, I might add, if they've expressed concerns, are they specific to the federal refugee program or are they broader in nature? Meaning, does it include concerns about unaccompanied minors, undocumented immigrants, or is it just with regard to the federal refugee program?
Ma'am, I think we have representation today from the city government of Amarillo who can speak to their specific concerns.
Yeah.
Regarding the other communities that have mentioned the impact of the Cuban parolees on their community, specifically regarding their capacity to provide full and comprehensive services given their resources to not only the refugees that are being resettled, but also the Cuban population that is eligible for the same services. And those communities that are more heavily impacted would be Houston primarily, and then after Houston, to a lesser extent, Austin and San Antonio.
Okay, all right, thank you. The questions have been raised about whether or not the state has any licensing authority over the resettlement nonprofits, whether it's got any oversight over them. I think you've made clear that that's not within the purview of the state.
We don't currently do that.
But are you aware that they have to go through federal audits and site visits and oversight by the federal government?
That would not surprise me.
Pardon me?
I'm certain that that's true. Yes, sir.
Okay, all right. And what about the churches or related organizations that work on these resettlement issues? Are they also reviewed, audited by the federal government?
Go ahead.
Hi, the local refugee resettlement agencies.
Yes.
They're under contract with national organizations, many of them faith-based, and those national organizations do carry out monitoring of their local affiliates. And the U.S. Department of State also conducts oversight of the resettlement agencies and their national organizations.
So they're just not out there on their own doing their thing without any kind of oversight from somebody. If it's not the state, the federal government is doing that.
That's correct. On the resettlement side is definitely the federal and then the national organization and the local affiliates. And I believe that your local affiliates that are on your panel today could probably provide greater detail on that.
All right, thank you.
Ms. Young and Mr. Randall, speak on page 17, the coordination issue with the state.
Yeah.
The current code, U.S. code, requires these resettlement agencies to meet regularly with representatives of state and local government. First of all, do they do that?
They do, for the most part. I think the frustration that you may hear in your next panel and the state's frustration has been, and we'll talk about that, is reflected by Senate Bill 1928 that you all passed last session, really is that while there is input from the state and from local communities, it is not binding on the decisions that the federal government makes as to allocations.
And so the second phrase of that coordination in advance, well, one, the coordination is really whatever the feds want to do after they tell you, is what I'm getting.
That's
what I'm getting. And in advance, does the in advance part happen?
So there is a process that happens where they say, we're proposing this many, the federal government will say, we're going to propose this many people in this allocation around the state. And then the state can respond and say, we have concerns about this particular piece of it, or we can express our concerns. But our concerns are not binding on the federal allocation.
And how often do they go against the concerns and wishes of the state regarding the placement of refugees into communities across the state?
We can provide background information on the historical information on that interaction and communication, and from interaction that I've had recently with resettlement agencies.
Well, give me your thoughts. You're the leader of the agency or the department division that's overseeing this for the state. What are people saying to you that are mayors and city councilmen and county judges regarding the concerns raised by either the state or the community and expressed through this coordination effort? I'll use that term lightly. What is your, not opinion, but observation of what is actually occurring?
Well, again, I believe that your representative, Mayor Amarillo, would be able to speak more directly to that, but I believe that there has been a very robust dialogue between the local representatives who do have concerns and our office, and with their local resettlement agencies.
When you say dialogue, they're complaining to you about the issue.
Oh, I mean, dialogue meaning we have been contacted by certain individuals, and again...
Inside the community.
Yeah.
Right.
And
How about school districts? We have laws in the state regarding a certain number of school-age children at a certain grade level requiring an actual class be taught in that native language. Has that occurred anywhere? That is, that obviously occurs with Spanish speaking, but does it occur in these communities that we have to teach in the native language? Or is that occurring with certain superintendent school districts?
I'm afraid I don't have that level of detail.
I think it's 22 students at one grade level. You have to do that.
Yes. We do
Like
have...
1 second, Senator.
On that point, look, it seems to me, let me ask you this. The governor raised his concerns, and others, about Syrian refugees coming in, and whether or not the federal government was failing to consult with the state of Texas. I'm not aware prior to that issue coming up that the governor or anybody at the state level had raised concerns about the refugee settlement program that you're describing here today. Is that a fair statement?
I'm not aware of concerns raised prior to some of the events in the
Right,
last
so,
November.
so I guess the point I'm trying to make here is that, look, this refugee resettlement program has been around for some time.
I agree completely,
And-
Senator, but right now there's a civil war in Syria and there are terrorists in Syria, and there have actually been various serious attacks in Europe as well as a Syrian refugee in Houston. So that's a special population, not unlike what occurred with the Iraqi population and when President Obama issuing certain types of edicts regarding that population back in 2011, Jimmy Carter with the Iranian population. So I agree completely that we should have a refugee program, but my concern is for the safety of the citizens of Texas. That is my obligation to these people, and I'm sure it's yours to the people of Texas as well.
Well,
and this
sure.
population needs to be thoroughly vetted. I don't have assurances, and I think many congressmen and individuals in our country have concerns regarding the process being utilized to vet these Syrian refugees, which are primarily male and primarily adults.
Well, we should, hopefully we'll have some testimony from somebody, DPS or somebody else, that can give us data, numbers that reflect how serious this threat is to us. I mean, we have one
It's
case.
serious in Europe, as you've seen on TV.
Well, no, I understand that in Europe. I'm talking about this country, and I'm talking about one refugee in Houston with very specific set of circumstances there. And that's what we're talking about at this point. I'd like to see what information we have.
I, for one, am not going to stand idly by and wait for something to happen to be known that it's serious in Texas.
Well, I mean, if we're going to make, it seems to me that if we're going to make public policy on this issue, we ought to base it on data and information that reflects the level and the extent of the threat. I understand what you're saying about Europe and other places. I'm talking about here in this country and specifically here in this state, since that's what we're dealing with here today.
That's exactly where I am right there, too. So,
All right.
other
Thank you.
questions of this panel?
Any other questions?
Thank you all very much.
Thank you, sir.